Thanks for staying on. In Focus, Newzroom Afrika, Channel 405. Your reporting continues now. For the first time in history, the World Health Organization has endorsed a malaria vaccine for children. Malaria is one of the deadliest infectious diseases. The mosquito-borne disease kills more than 500,000 people a year in sub-Saharan Africa. This includes 260,000 children under the age of 5. The endorsement for this vaccine is based on results from an ongoing pilot program in Ghana, Kenya, and Malawi that has reached more than 800,000 children since 2019. The RTS vaccine, made by the British pharmaceutical company GSK, was developed more than 20 years ago, but by itself is not highly effective. A new approach shows that using existing medicines to prevent malaria has been shown to reduce severe cases of malaria among infants by more than 70% in sub-Saharan Africa.
Today, WHO is recommending the broad use of the world's first malaria vaccine. This recommendation is based on results from an ongoing pilot program in Ghana, Kenya, and Malawi that has reached more than 800,000 children since 2019.
Now, to discuss this story further, I'm joined now by the Goodwill ambassador and board member for End Malaria, Ma'am Yvonne Chaka Chaka. Ma'am Yvonne, good evening, and thank you very much for your time and joining us today. For years now, you have been involved with this particular pandemic. Malaria, one of the biggest scourges on humanity for a while, and mostly kills babies and infants. What does this endorsement by the World Health Organization of this vaccine actually mean?
Good evening, Tabo. Good evening to you and your viewers. To me, it's like my job as a Goodwill ambassador is done. You know, for us, the global community, it's a historical moment. I'm so elated. I'm sure different organizations like Muswaswa and Malaria Fund, Goodbye Malaria, and Rollback Malaria are saying what we've been working for, what we've been fighting for has come to fruition. As a Goodwill ambassador, it makes my work very easy that the work that we've been doing has actually come to fruition. You imagine children under 5 who are vulnerable, dying, and not having the medication. And now they can go to the clinic or to a healthcare center and have this medication for this disease that kills them.
Yeah. Many people might understand the impact and the burden of disease caused by COVID-19, but very little is being said about the burden of disease caused by malaria, and that's why we have you as the Goodwill ambassador to spread that message. But just expand on that. How severe is the situation on the continent?
Malaria kills about 500 people per annum, which is very sad, and about 269 of those are children under 5. And whilst we recognize what the pandemic is doing now, COVID, we shouldn't put the brakes on malaria and HIV. So it is very, very important that we know that these diseases have been there for a long time. I mean, this is after 30 years of research and development, and today this is being done. It's not that people have not been trying. And for me, I think it's very important and to acknowledge all the multiple disciplines that came together to make sure that we have got this vaccine today. Thanks to, JSK, thank you to WHO that has recognized this, and they are saying today our children under 5 are going to be given the life. So we need to make sure that the logistics are done correctly, the payment, the amount, because sometimes these things become very expensive and countries that are poor get left behind. So when we talk of the development goals, sustainable development goals, where they say people should not be left behind, we need to know that how much is this going to cost? Is it going to be freely available to the countries that need it? What are the logistics of these? So those are the things that we must look at. But for me, it's a great milestone, and I want to say, when you invest, when you do your proper research and development, you can then see that people will live. It's a great political will, and thanks to those people who've put in the money, who've done the research and invested in this so that the next generation can live.
Yeah. Speaking of Will, one of the things that you do, of course, is to promote vaccinations, or at least the treatment of malaria. Now, with vaccine hesitancy being on the rise, particularly when it comes to the COVID-19 vaccines, what would be your message at this time? Because, of course, with this vaccine now out, this would need to target a number of people, and those targets are going to be quite high.
Well, a lot of research has been done for this malaria vaccine, Tabo. Obviously, I know that work is being done even for COVID malaria, for COVID vaccine. I think people should not be forced for this. People need to trust. People need to know exactly what is happening. And it's for government to educate people, conscientize them, give them proper information when it comes to the vaccine of COVID. I know it is important that people have to be vaccinated, but we should not be forcing people, but people should be educated, they should be conscientized, they should be given full information about the COVID vaccine. So these are two different things. Malaria and COVID are two different things, but we want people to live, we want to save lives, we want people to go back to work, we want to go back to normality. That is my wish and what I would love to see.
Yeah. From an equal access point of view, I mean, we have been talking, of course, particularly on the continent, about vaccine inequity. What would be your appeal? I mean, this is a European company, I suppose, that has come up with this vaccine, but as far as making it accessible on the continent?
As I said, logistics will be something that we have to look into. We have to look at the pricing. We want to see if this vaccination will be freely available to those that need it the best. We don't want the vaccine apartheid where first world countries will be the ones who are getting it. You know, obviously, there's very little malaria in the first world. So it's done for this continent. So we need to look at the pricing, we need to look at the logistics, we need to make sure that it is there, because people walk hours to go to healthcare center, and when they don't find the medication or the vaccine, they go back home and they die. So we need to make sure that each and every place where people will be going to a healthcare center, the vaccination is there, because that's what makes a lot of people die. Because when they go there, there's no medication, there is no vaccination, and they go back home and walking miles and miles, and when people do not have money, it becomes a huge problem. So we need to plead to our governments, we need to plead to our healthcare workers and everybody to make sure that this is there, and the pricing should be just good for this beautiful continent of ours and save our children's lives.
Now, of course, this vaccine developed by JSK is not a replacement for the other measures that you have been promoting. And I know, for example, you do a campaign around the nets as well that need to be acquired. What else are you promoting, and what other projects can people go to that certainly support the work of controlling malaria on the continent?
Well, there's different organizations, as I mentioned. End Malaria is a global one. Goodwill Malaria, End Malaria Fund, Newzroom. So when we collaborate, when we work together and not pull, back, we will make sure that the work of different organizations and different advocates becomes very easy. For me, as an advocate, as a Goodwill ambassador, it will be very easy for me to go to different places and make sure that our people, particularly children and pregnant women who are always vulnerable, have the vaccine. And I'm so elated. I really don't know what to say, but I just want to say so much money has been spent. Research has been done. It's a historical moment. I'm just happy because, when you see different people working together, collaboration, multiple disciplines coming together, we will definitely save lives. This is not the time for us to put the brakes, but it's the time to say where and how are we going to make sure that our people, particularly our children, live.
Right. Ma, thanks for jumping on and very much for giving us the information tonight. Goodwill Ambassador and board member for End Malaria, Yvonne Chaka Chaka, there with us tonight. Of course, breaking the news of this historic moment. For the first time in history, the World Health Organization has now endorsed a malaria vaccine for children. Malaria, one of the deadliest infectious diseases affecting the continent.